Hi everyone, it's Dr. Jhawar with Revive MD Direct Primary Care. I'm continuing my discussion about some of the test results that you see on an advanced lipid panel test. So if you haven't seen my previous videos discussing about advanced lipid panel and what the numbers sort of mean and what's sort of tested on it, you can look at my previous videos on that. But today we're going to talk about one of the values and numbers that you see on there called the Apolipoprotein B, or Apo B for short. Now, what is this, right? So this is an actual protein that carries and transports the bad cholesterol. So your LDL particles and your VLDL particles, those are your bad cholesterols, and it helps carry those bad cholesterols through the blood. So it makes it easier for those particles to circulate then through the blood and then cause things like plaque formation and blockages. So sometimes people will say, well, if you have elevated levels of apolipoprotein B, that's like even worse than just having high LDL levels, right? Because now you've got this other thing that's actually transporting more of that bad cholesterol through the blood. So in fact it is, and it does increase your risk for heart disease, in the future. So how do you manage or treat, somebody who's got elevated ApoB levels? Well, definitely that's where there's indication for medications like cholesterol lowering medications like statins, of course, but also significant lifestyle changes like really modifying the diet, following a Mediterranean diet, exercising, getting adequate sleep, quitting smoking, reducing alcohol, things like that. But these are all ways that you can reduce that ApoB level and then reduce your risk for heart disease significantly. So I hope that gives you some information about ApoB and its role with cholesterol.